So in terms of the team that work in operating theater, the surgery was the heart surgery and lung surgery are very specialized types of surgery. In terms of the specifics and involvement of equipment and organizing things, cardiac surgery is probably the most complex of all other specialties with respect to all of the other highly skilled surgeries like neurosurgery and vascular and pediatric surgery, etc. The involvement of the heart-lung machine, the involvement of very fairly specialized care in intensive care unit makes it all, the whole process requiring good coordination of things. The people who I work with both in private and public practice, but particularly in private practice, are predominantly people who I select, who would work with me. During the one cardiac operation, there are probably around 8 to 10 people in operating theater, each of them being their specific role. So there is myself as a surgeon, and the surgeon does lead the team. This is the combined force that brings everyone together and steers the wheel, and that's very important. And what I've learned with time, that all people may have a little bit various ideas with each of members of the team, but it all constantly has to be tightly controlled to make sure that we get the best result for the patient. There is an assistant surgeon who helps me in the operation. There is a scrub nurse and a scout nurse. They both specialized in cardiac surgery. There is an anesthetist specifically involved with the cardiac surgery. This is a cohort of the highly specialized specialists. There is an anesthetic nurse. There is a perfusionist, the person who looks after the heart-lung machine. During the heart operations, for most of the cardiac operations, the heart is stopped and lungs are stopped for a period of time, and the heart-lung machine does the job of these two organs. Not infrequently, there are two perfusionists. And there is one or two operating theater technicians who help with positioning of the patient, making sure that the equipment works. And it's very important that each member of the team does their job well and the surgeon controls it. The atmosphere in operating theater is very important. When we start the surgery, we make sure that all bits of equipments and testing and monitoring are working well. So it's better to do things properly. So we've got the work of the arterial line, of the venous line, of the saturation probes, and that's very important to how the proper and well the anesthetist does that, where we plan the incision, how we position the patient. So everyone is concentrating on that part of the operation. And then when there is the surgery itself, everyone concentrates a lot on what we do. I don't like too much talk or noise in operating theater, and people know that. I can hear very well the anesthetist, the perfusionist, the assistant, and the people who I work with tend to stick to this demand of mine, saying that the working atmosphere is very good. And by the end of the surgery, when we make sure that the heart started, lungs started, and that it all works well, if it's mitral valve repair or replacement of the aortic root, aortic valve works well, that after bypass grafts the heart is really happy. It's so fantastic to see when the heart was not doing really that great, and when you put the bypass grafts, and at the end of the operation it just wakes up and it just works better. Undescribable feeling, and everyone becomes a bit more relaxed, and we start going towards the end of the surgery, and the atmosphere and even the temperature in operating theater warms up, and it's part of the management. It's really good feeling when people enjoy working with each other, and that's part of the success with the final outcomes, great outcomes for the patients.